dystrophic calcification, this is when calcium deposits in a dead, degenerated tissue or necrotic tissue. And in patients with dystrophic calcification, their serum calcium and phosphate level are within normal limits. So the reason why the calcium is depositing in those tissue is because those tissue are necrotic, injured, dead, or degenerated, as we saw in the question we did earlier. So let's look at the pathogenesis of dystrophic calcification. So we have a necrotic or a degenerated tissues, and this tissue release phosphates from the membrane phospholipid via phosphatase. So that phosphatase release phosphate from the cell membrane of those degenerating or necrotic cell. And now that gives opportunity for calcium to enter those tissue and bind to phosphates and then form calcium phosphate crystals. And then when you apply your H and E stain, right, so they're going to appear basophilic, they're going to appear slightly blue, as you can see in this image that was taken from a patient with invasive ductal carcinoma. So now let's look at some high yield examples of dystrophic calcification. So one is calcified granuloma, as we see in tuberculosis. And if you have not watched the video that we did on granulomatous inflammation, because we did an extensive job in going through granulomatous inflammation, we talk about different type of granulomatous inflammation, I strongly encourage that you should watch that video, and it's going to help you. The next example there is calcified thrombi. So if you have a blood clot that is chronic, then calcium could deposit in those blood clots. Next is atheroma calcification. So if you have, in the case of atherosclerosis, and there's atheroma formation, with time, calcium could deposit in those atheroma. Next is Mockenberg medial sclerosis, which is calcification of the tunica media of muscular arteries. And it's important to know this is involving the tunica media, and this does not affect blood flow, except if there's now involvement of the intima, like in the case of atheroma or atherosclerosis. And these are the patients on examination. They usually describe them as lead pipe appearance. So when you touch the blood vessel, they appear as a pipe, right? And next is breast microcalcification. So this is seen in conditions like ductal carcinoma in situ, also fat necrosis. And then we did a recent lecture on fat necrosis. So I strongly encourage you guys to watch that video. It's going to help you. Next is pancreatic calcification in the setting of chronic pancreatitis. So if you see an image showing calcification of the pancreas, always think of chronic pancreatitis. Next is ventricular calcification in the setting of infection like congenital infection like toxoplasmosis and CMV. Next example there is calcified stromas in tumor, like in the case of somebody who have uterine fibroid, and now the uterine fibroid has calcified. Also breast tumors. Calcified pineal gland is also another one, which is age-related finding, and it's an important landmark because it's in the midline when we're reading the CAT scan of the brain. And the last one there is aortic stenosis. So a degenerating aortic valve, calcium could deposit in it. And that's what we saw in the question that we did earlier. So now there's another main example of dystrophic calcification, which is well tested on the exam, and this is called Samoma bodies.